Usually the way I've been doing it, I'll get my patient to step up there. I'll get them to turn and face me.
Okay.
We'll get one arm in.
Okay.
And then I'll get the other arm in.
Okay.
Yep.
There we go.
You can. So. Now, most of the time, I don't tighten anything.
Okay.
Because even when it's loose, it still fits pretty well.
Oh, yeah.
Now turn and face that way.
Okay.
So one thing that I noticed, this particular harness, now we bought this harness separate.
Mm-hmm.
It's a heavy harness. Like if you just feel the weight of the harness, to
yeah.
you it doesn't feel like much. I've got a video coming out of a little lady who's probably 90 pounds. The harness itself felt heavy to her.
Oh, interesting. Okay.
So I adjust the vertical strap so it's, you know, good. How does that feel to you?
Feels good.
Go ahead and sit down into it so you can kind of feel what that's going to feel like.
Nice and comfortable. Yeah.
Here we go.
Okay. All right. So again, we're here with Tony. We're demonstrating the Reactive Step Trainer. So he's got me all harnessed up, which is great. So the Reactive Step Trainer is great because it offers a variety of up to 5 different types of perturbations that clinicians can add or have their patients do. As we first come in here, we always make sure that the screen asks, are the individuals safety checked? We always have to hit yes, they're safety checked before we can move forwards. What we then move into is kind of a practice trial or pre-training. What this allows is the therapist to make sure that the patient feels comfortable walking with the harness on, that they feel secure on the treadmill. And the nice thing is this actually goes in 0.1 speed increments. So you can go 0.1, 0.2, 0.3, etc. So you can kind of help to lock in a great pace. So we're going to just 1 mile an hour for today, getting used to the settings. Again, the patient might take a few minutes to kind of get adjusted and acclimated. That's great. That's kind of what this pre-training is for. Once they feel good and comfortable, the therapist will then go ahead and hit stop. All right, belt comes to a nice easy stop. We go to next. Again, the safety warning is always going to ask, are they safety checked? Safety harness in, you hit safety check, yes, and away we go. So here is the 5 types of perturbations that this treadmill, this Reactive Step Trainer offers. We can do trunk stability, slip, trip, step, and walk stability, and then E-trip. So for today, what we're going to focus on is a trip on demand. Tony's going to really put me through the paces here, and we're going to bump up the speed to 2 miles an hour, which is the max speed that it can go, because a lot of published research and everything shows that this is going to be the best speed at which to induce that trip and on demand. So once that's all set up, we hit the start button. The session is in progress. Tony is going to grab the remote, and then without me knowing, he's actually going to hit the start button.
So I'm going to start it.
All right. So now I'm walking, again, 2 miles an hour. I'm safely harnessed in. And this is on demand. So this, as Tony is the clinician, he can maybe join in on a voiceover. But Tony, when you're having somebody on demand on this, what are you looking for?
So first I want to acclimate them a little bit to what it's going to feel like, what it's going to do. I will typically have them hold on to the handrail first. I will tell them I'm going to push the trip button. I'm going to count down from 3, 2, 1, and then I'll push it. So I'm going to push the trip button, 3, 2, 1. And so that gives them the chance to feel it. Mm-hmm. Then I'm going to ask them to remove their hands from the handle. And I'll tell them again 1 or 2 times, I'm going to count down. So I'll do it. I'm going to count down 3, 2, 1, 3, 2, 1. And then once they've gotten to the point where they've done it, they understand, they know what to expect, I'm not going to tell them anymore. Okay. And what I try to do from the therapist side is, I don't want to always do it at the 60-second mark or at the same time. I don't want to build a rhythm into it. I just want them walking, and then I'll go ahead and press it. And so I want that kind of startle response. I want them to react. I want to see how they feel. And we might be having a conversation about the weekend. And then again, I'm going to push it, and they're going to react.
Excellent. So Tony, this is great. So as a therapist, obviously you're working with individuals across all aspects of life here and conditions. And maybe when you're looking at my posture, and maybe I'm complaining of maybe hip pain or low back pain, in your professional assessment, what is this device going to help you in conjunction with that individual?
I think a lot of the benefit from this is just everybody's going to walk different. There is no perfect walking pattern. There is no perfect posture. Your best posture is your next posture. We've all heard that, and it's true. What this allows me as the therapist to do is to get a baseline assessment of what is normal for you. And then based on the pathology and the complaints that you're experiencing, we can start to tweak what's normal to maybe try to improve or reduce symptoms or pathology or something that's going on. Let's
go ahead and hit stop. Excellent. Okay, so the next one we're going to do is the 5 slips, and the little images are here, but we can do a little walk stability. So if we just simply select walk stability, it has 5 levels, 1 through 5. So 1 being the most subtle, 5 being the highest level. So what we're going to do is, okay, and then Tony can hit the start button again. All righty. Now, the sequence options are on random. It can repeat. Oh, so that's what it did. It walks and then it slows down. So it gives you a few minutes, and then what Tony's going to do is he's going to hit the button again. It's going to give me a chance to catch my balance, walk out a couple steps. The belt's going to come to a stop, and then he is literally just controlling it by the remote. So whenever he hits it again, now the way we can equate this, the purpose of this is, think about it in terms of you're walking in through the airport and you start to go get on the people mover. That initial jolt is going to actually send people walking a little bit farther forwards. So that's kind of one thing that we're using for the therapist that can help train that individual.